Hello, this is Dr. Wickham Simons. I'm an obesity medicine specialist in the Triangle area of North Carolina, and this is Obesity Medicine Perspective. Today I'm here with Bill. Bill is from Tallahassee, Florida, and Bill and I are going to show you how the Inbody 770 is used and how it generates a very accurate report of your body composition. I've been talking about this on my previous videos, and if you've been watching those, I've been offering you a chance to follow us on Facebook or Twitter, actually Facebook and Twitter. And if you watch these videos and follow us on YouTube, you've seen that and you know that you can get a free Inbody test. Well, a lot of people haven't had a chance to visualize what that test is about. What does it look like? What's involved? So I wanted to show you someone actually doing it, and Bill graciously volunteered to demonstrate for us how this works. And so we're going to show you that. The Inbody is a special scale that uses very low doses of electricity that you don't feel, and it does it through your hands and your feet, and through those impulses of electricity and some physics principles, it is able to tell you exactly how much lean mass you have and where it's located, and exactly how much fat mass you have and where that fat mass is located, and it prints it out on a very nice report. So we're going to show you the procedure, how it works, how easy it is, and then you'll have a good frame of reference in your mind for how this whole thing works. And if you want to get one of these, all you have to do is follow us on Facebook and on Twitter, and let the office staff know, and they'll be glad to set you up a time to come in and do it. It won't cost you anything. So the first thing I do is use a special piece of tissue paper that Bill's going to use to wipe his hands and his feet, the palms of his hands and the soles of his feet, and that's going to allow the test to conduct the electricity in the most efficient manner. There you go. Okay, let me see that, Bill. Now, okay, Bill, what I want you to do is to step right up on the scale and center your heels on the little place, the appropriate place on the scale.
Do not grab the handle or move.
So the scale is measuring Bill's weight.
Weight measurement is completed. Place your heels.
And so your heels are already centered, so you're good to go. The scale's talking to him, giving him instructions. Now he's going to grab these handles,
Place your thumbs on the oval
and he's going to stand with his arms out.
Keep your arms straight. Your arms must not touch the sides of your body. Starting your in-body
So the test takes about 30 to 45 seconds, and the whole time the scale is talking to Bill and telling him exactly what to do. So he's essentially just standing in that position with his arms out. That's all that's required. He can't feel anything at this point, but the scale's doing a lot of special work here to determine multiple parameters about his body composition.
The test is completed.
Okay, there you go, and you can just hang those back up. You can step off. So, Bill, was that painful in any way? Did you feel any electricity? It was easy to do, right? Yeah, so that's exactly how long it takes. And now what's going to happen is the scale is going to send a message to a printer and print out a nice detailed 2-page report. And then I'll use that report to explain to Bill kind of what his body composition looks like and how it compares to other people his same height and age. And then when Bill's doing a diet, over time he can repeat this test and track what his progress is. Because the whole idea, I told you back in the beginning, that obesity is a disease of excess body fat. And you don't want to lose lean mass while you're losing weight. The whole goal is to lose body fat because that's the disease. The disease is excess body fat. The treatment is to lose that excess body fat. So the report is a nice 2-page document. You can kind of get a general idea of how much detail is on there. And so I'm not going to go over every single parameter on the report, but you can see from the video that it is very detailed. Now, the one thing I'm going to want to work on with Bill is in the top right corner up here, and that is a measurement of Bill's visceral fat. That's that abdominal fat I've been talking about. When you have the high insulin level, you store a lot of fat, and Bill knew before he came here that he had some excess abdominal fat, and the measurement that the scale took shows that exactly he has that, and so it gave us a precise area of that in square centimeters of that fat. And so we're going to want to track that as he goes along as a parameter of his diet to make sure that that's going down at the correct rate. And that, you know, that's why I teach diets that lower your insulin level. This is an important concept. We want to get that fat down because that kind of fat is not good for you. So if you'd like a test like this, all you have to do is follow us on Facebook, follow us on Twitter, and please keep watching these videos. They'll update you with information. And until the next time we talk, I'll give you the tools, you give me the effort, and together we can overcome obesity.